Welcome everyone. Today we have our another new episode and we will discuss on AI in healthcare. We have our world famous speaker, Mr. Rob Enderle. My first question for him, how can AI improve diagnostic accuracy and speed in medical imaging?
Well, so they're kind of two different questions. So at least with regard to diagnostic accuracy, what AI can do is it can look through massive amounts of terabytes of data and try to determine what best matches up to the symptoms that are being presented. The first workup of IBM Watson was medical, and the example I was given from one of the researchers was, and it was an MD, was that he'd spent the prior 3 or 4 years trying to diagnose a woman who had a debilitating illness, and nobody else had been able to figure out what it was. And it took him 3 or so years to figure out what it was, and it was an unusual rare illness, and find a cure for her. When they put the symptoms into Watson, this was nearly 2000s, it listed 30 or so potential illnesses. The one that she had was number 8. And so it would have taken the time to diagnose down from 3 years to several days, because they would still have to go through all the first, 8 possible illnesses and then find that the one, in other words, do the diagnostic work to make sure that it was the one that was chosen. But it substantially reduces the time to remedy, and that's incredibly important. The problem, of course, is you need data access, and the reason IBM exited the medical side of AI was because it was just too hard to get access to the data. The different rules surrounding providing data, even when you use federated data, became too big a problem for them, and so they exited. So other companies are working with AI and healthcare, but this data access problem has been problematic in terms of making it work. Now, with regard to imaging, what's kind of interesting about the imaging is where particularly generative AI has been very successful is at analyzing images and being able to look and see things that the human eye may not be able to detect. And the end result is it can now go through, and I think the most recent example was with regard to mammograms. It's able to identify a potential for breast cancer now months in advance of when a doctor would typically be able to identify the disease. And that makes the remedy far less invasive and painful for the woman, much less of a chance of having to do a mastectomy or a single or a double mastectomy, which can be really damaging to the woman's identity and her sense of self. And so the end result is AI is now demonstrating that it can provide much more timely identification and cure for breast cancer, and likely for a number of other cancers as well, as it's trained up. Because when it comes to images, it's really good with images, as long as the training set is well done, and it can discover things that the doctors just simply cannot see.
Thank you. My next question, what are the ethical considerations and challenges of using AI in patient care?
Well, the big issue is data access. There are so many restrictions surrounding the use of medical data and individuals, and those restrictions are in place for good reasons, because if people get access to that information and they want to use it in a hostile fashion, they could take advantage of the patients and not to mention do them harm. Somebody finding out that you had some kind of a rare allergy they didn't like, you could introduce that food into what you're eating and cause significant problems. And so there are legitimate concerns about the control of medical information. On the other hand, AIs have to be trained with something, and we have massive amounts of medical information now that could be applied to training up the AIs. Now we do have to. There's also massive amounts of incorrect medical information out there. Remember, with regard to COVID, there was misinformation surrounding horse pills that were designed for horses, as well as other things that were unfortunate. And you do have to make sure that false medical information doesn't get in and corrupt the system. But if you can get access to the information, then the AI can do amazing things. You're muted, or at least I can't hear you.
The next question for you, how can AI be integrated into into healthcare system to support clinical decision making?
Well, so it becomes part of the decision process for the doctor, and you're breaking up a bit. Your image is going in and out too, just to let you know. But the doctor uses this right now not as a replacement for their diagnosis, but as a way to inform the diagnosis and to make sure that the diagnosis is fully informed. So a typical general practitioner doesn't have the depth in any single area of study to be an expert, and so they rely on experts. But often those experts are located, all over the world and not convenient. So what the AI can do is can provide that expertise, even from experts that are no longer with us, and can inform the doctor on how to better treat the patient and take into account a lot of variables that the doctor is just unable to take into account. Differences in blood type, differences in genetics, differences in their heredity, and the end result is the AI can step up and behave much more like an expert, providing that advice to a general practitioner or a nurse real time, and reducing the need to have an expert called in. And it's often, even though you can Zoom call in an expert or do telemedicine and telesurgery, it's always helpful to have the doctor there on premise and able to see the patient, because it's not always easy to tell what's wrong from patient just from the data. Often you can tell that there might be a difference or something you might not have otherwise realized by seeing the color of the irises in the eyes, by seeing the overall demeanor of the patient, and by looking for other things like curled nails and the overall skin pallor, which may not come through on Zoom or over video conferencing or through other video methods. So it does provide a way for a nurse or a general practitioner to have the same kinds of capabilities of a highly trained expert and be much more performant in their task. Potentially.
Thank you. My last question for you: what impact could AI have on healthcare accessibility and delivery in underserved regions? And what's your
so often the case is, and we really looked at this for telemedicine and telesurgery, but with regard to telesurgery, you still have to get the equipment out to the remote location, which is kind of problematic. We have a lot of people that live really far away from hospitals and all over the world, and yet they still need medical care. And you can certainly have instances where somebody's hiking and they're injured and they can't be removed from the location very easily, or they might be exploring in the North or South Pole, or out in the middle of the ocean on a cruise ship or a private boat or ship, and have a medical emergency. And here's where really an AI could be a huge help, because in a lot of cases they may not have decent bandwidth and communication, so telemedicine may not work. But having an AI that's local with an adequate repository, which in theory could be carried, could provide the basic medical advice to at least stabilize the patient and get them to a position where they can be moved out of their remote location and get to medical care. So it could significantly save lives. And by the way, one of the applications for AI, which is autopilot and autonomous driving, could also allow for an autonomous vehicle to fly out, pick up the patient, and then take them to a place where the patient could be served and cured. And this is something we often can't do, because we do use helicopters, but helicopters have real restrictions as far as where they can go and what they can get into. Where a drone that's designed to carry a patient is not much larger than the patient themselves and can get into much tighter spaces. And of course, if the drone crashes, the drone is cheaper than a helicopter, and you don't have a pilot, so you're not losing the life of the pilot and the co-pilot in the process. And right now we're short of both of those. So with an autonomous drone, you can also remove the patient and potentially get them to help that otherwise wouldn't have been provided. So AI can both help stabilize help inform somebody how they can best stabilize the patient, and also get transportation to the patient in a way that doesn't put air crews at risk, and can be flown into areas that are in heavy weather and are in much tighter quarters than a typical helicopter rescue could be undertaken.
Thank you. For audience, please share our content as much as possible.